Madam Speaker, I'll be supporting the repeal of minimum unit price. This decision, a key election commitment of our government, marks a departure from the previous administration's approach and reflects our commitment to finding effective, evidence-based solutions to the complex issue of alcohol-related harm. The minimum unit price, introduced in 2018, mandated a minimum price of $1.30 per standard drink for low-cost alcoholic beverages. This policy, a recommendation of the Riley Review, was intended to curb excessive drinking while minimizing the impact on moderate drinkers. However, as we have seen over the past few years, the minimum unit price has fallen short of its objectives. The minimum unit price has proven to be a blunt and ineffective tool. Firstly, enforcement of the minimum unit price has been lacking. Shockingly, despite the existence of numerous grocery store liquor licenses, not a single compliance check or minimum unit price related condition was imposed during its implementation. This lack of oversight fundamentally undermines the policy's effectiveness. Secondly, the minimum unit price has led to unintended and concerning consequences. Data reveals an alarming trend. While the sale of cask wine decreased, consumption of higher alcohol content beverages surged. This suggests that minimum unit price merely shifted consumption patterns towards more potent and potentially harmful alcohol products. Thirdly, the minimum unit price has failed to deliver any measurable benefits in terms of reducing alcohol-related harm. In fact, the minimum unit price's implementation, we witnessed a concerning rise in both alcohol-related assaults and emergency presentations. This underscores the ineffectiveness of the policy in addressing the core issues. Finally, the minimum unit price unfairly penalized all Territorians, forcing them to bear the brunt of higher alcohol prices without seeing any tangible reduction in alcohol-related harm. This burden disproportionately affects responsible drinkers and those struggling with the cost of living. It's crucial to note that the Northern Territory stands alone as the only Australian jurisdiction implementing the minimum unit price as an alcohol harm reduction strategy. This isolation raises questions about the policy's validity and effectiveness. Frontier Economics, on behalf of the Northern Territory Department of Health, prepared a report titled Evaluation of Minimum Unit Price of Alcohol in the Northern Territory. A pertinent question arising from this report is whether the minimum unit price can be definitely identified as the sole contributor to any observed decrease in alcohol-related harm. This evidence presented in the report does not support such a conclusion. Instead, it suggests that while the minimum unit price may have contributed to a reduction in alcohol-related harm, its impact cannot be isolated from other factors. The report highlights that the observed effects were influenced by multiple interconnected interventions and external events. Notably, the COVID-19 pandemic significantly impacted alcohol consumption patterns and related harms, with changes observed post-minimum unit price introduction being relatively minor compared to the pandemic's influence. This complicates effort to attribute reductions in harm to a single policy measure such as the minimum unit pricing. Other concurrent policy measures, including the banned drinker register, police auxiliary liquor inspectors, local licensing agreements, and regional variations in the implementation of these initiatives, further confound the data. As a result, the available evidence does not establish a causal relationship between the minimum unit price and a reduction in alcohol-related harm. The report also notes that while the minimum unit price reduced the consumption of certain alcohol products, such as cask wine, there was a corresponding increase in the sales of other types of alcohol, most notably spirits. This evidence of substitution indicates that reduction in one category of alcohol consumption were offset by increases in another, further complicating the assessment of minimum unit prices' effectiveness as a standalone measure. The minimum unit price has also failed to address the realities of alcohol access in communities struggling with alcohol abuse. The thriving black market for alcohol in 𝙿𝙾𝚃, where a bottle of Bundaberg rum can fetch exorbitant prices, demonstrate that price is not a deterrent for those determined to access alcohol. Additionally, critics argue that minimum unit price primarily benefited bottle shop profits without effectively tackling the underlying issues of alcohol-related harm. This raises concerns about the policy's true impact and its potential to exacerbate existing inequalities. Our government's decision to repeal the minimum unit price signifies a shift towards a more pragmatic and evidence-based approach. We are committed to tackling alcohol-related harm, crime, and violence through targeted community-driven initiatives. We are implementing new public nuisance drinking laws that empower police to address alcohol-related offenses in prohibited areas. Additionally, we are developing community-led alcohol management plans that focus on addressing the root causes of alcohol misuse. We also recognize the importance of alleviating cost of living pressures. We expect the liquor businesses to pass on the cost savings from the minimum unit price repeal to consumers, ensuring that all Territorians benefit from this change. The repeal of minimum unit price necessitate amendments to the Liquor Act 2019 and Liquor Regulations 2019. These amendments will remove provisions related to the minimum unit pricing, including the definition of minimum sale price, and operationalization of the minimum unit price. Specifically, Part 5 of the Liquor Act 2019, which deals with minimum pricing, will be repealed. The definition of standard drink will be updated, and penalties related to minimum unit pricing violations will be removed from Liquor Regulations 2019. While minimum unit price effectively targets harmful consumption and mitigates alcohol-related health inequalities, its effect on public drunkenness and crime is less definitive. Most studies suggest minimum unit price is part of a broader suite of policies needed to address alcohol-related harms comprehensively. Madam Speaker, in addition, there was also discussion around the data and the experts' advice regarding this as well. So for a person who worked in the hospital, especially in the Northern Territory, and also been in a role as a director overseeing the alcohol and other drug services in the top end region, I have seen the quality of the data is not something that we can really rely upon. The reason being about I think we are still using the data system that most likely developed around 20 to 30 years ago. So the ability of the system is not something that we can really take on, and I think that's a real concern as well. And one of the solutions was the Acacia, which the Minister Jinson has clearly outlined about the issues over the last few weeks as well. So that was the promise that the previous government has given to the healthcare workers to ensure we will have I think clear data in terms of not only just alcohol-related issues, but a range of issues that the data is really relevant when it comes to addressing these kind of issues. So when it comes to the data, and I think all this expert advice based on the current data, there are real concerns because we had discussion in this chamber before around how we can use the data and how we can take the specific data sets what really complement the discussion in this chamber. So in summary, minimum unit price has not demonstrated public health benefits, especially for reducing harmful alcohol consumption and its associated harms. In addition, it must be combined with support systems for those with severe alcohol dependence and other policy measures to address broader societal impacts. The repeal of the minimum unit pricing in conjunction with these complementary strategies signifies a commitment to evidence-based policy making that considers the broader social and economic context of alcohol consumption. The government's focus on collaboration with communities, stakeholders, and experts further emphasizes this approach, suggesting a shift toward a more inclusive and participatory model for addressing alcohol-related issues. By focusing on targeted interventions, empowering communities, and addressing the underlying social and economic factors contributing to the alcohol-related harm, we can create a safer and healthier Northern Territory for all. I commend this bill to the chamber.
Thank you, Member for Sanderson.